Hi, I'm Noah Lewis, founder and executive director of Transcend Legal. Happy National Coming Out Day! I came out as transgender in 2004. I had been slowly realizing it for months, and in March of that year, I called up my parents and said, I think I'm a boy. They asked me some questions, and they were very calm about it. My mom asked if I was going to physically transition, and I was like, no, I don't have any plans to do that. They were far ahead of me on that one. We hung up and I thought, that went well. But it turned out they were just in shock. This fundamental thing they thought they knew about me was turned upside down. So the next time we spoke, they were pretty freaked out and angry. They are, as I like to say, Fox News watching Republicans who voted for Donald Trump. Not exactly the people you might expect to be psyched about having a trans kid. In 2004, Chaz Bono hadn't come out yet. There were no well-known trans people out in the public eye, so my parents had no one to look to as a model. They were embarrassed to tell their friends. Now, for some parents, it's a little bit cool to have a trans kid, but 13 years ago, it was a different story. So for the next 2 years, it was hard with them. They were constantly pushing back and questioning, why are you doing this? Why are you doing this? Meanwhile, I was in the middle of law school. That summer, I had a job lined up working on animal law, which is why I went to law school in the first place. I worked that job for about 2 weeks, but I was depressed. I was isolated, and I couldn't take it anymore. So I quit that job, and when I went back to law school in the fall for my third and final year, I went back as Noah. Some of my more knowledgeable friends asked what pronouns I wanted to use, but I was still shy at that time about using he because it takes a lot of courage to use a different pronoun. It means making a public statement about who you are. This idea came to me that I should legally change my name on my birthday in January. At the time, that schedule seemed a bit rash, but at the same time, I knew I never liked my old name. So on my 28th birthday, I officially became Noah. But it was still hard to focus on law school. I remember one time it was finals and I was in the library, and instead of studying, I was on Yahoo groups researching top surgery. And I was dealing with trying to get coverage through my school's health plan and coming to realize it wasn't going to happen while I was still a student there. It also became apparent that I wasn't going to be able to study for the bar exam that summer because I was not functional. But I did manage to graduate, and I became the first openly trans person to graduate from Harvard Law School. I was the only person I knew to graduate without having a job lined up, which was made worse since I couldn't take the bar exam. It's hard to get a job as a lawyer if you're not licensed to practice law. So I moved back to Pittsburgh, where I'm from. I couldn't bring myself to do much of anything because I was so depressed. I worked on getting top surgery scheduled, which I had in January of 2006, paying out of pocket. I had top surgery before starting testosterone because I knew I didn't want breasts. I had never wanted them. But I was nervous about testosterone and it being able to change your brain or change your personality and all these fears that you have. But I started testosterone in April, and it's no coincidence that I got a job a few weeks later and moved to Connecticut. But then what happened was that one weekend I noticed I felt terrible. I had no idea why. And then it was maybe 2 weeks later and I felt completely awful again. But then I had this light bulb moment. Oh, the testosterone wore off. You take the shot every 2 weeks and the levels had gone down at the end such that it wasn't working anymore. And I was actually feeling like I used to feel all the time. And it's sad to think about. I lived so much of my life in a state that was so completely abnormal, only I didn't know it. It's hard when you're in that state to know that you can ever feel any differently, but thankfully I did. And I have no explanation. There weren't any real physical changes at that point. It wasn't about the physical changes of testosterone. It was about brain chemistry. My brain works when it's getting testosterone, and it doesn't work when it's not. So for me, the time period after coming out and before getting trans healthcare, that was the worst period of my life. I was no longer in denial about being transgender, but I was dealing with the dysphoria, the mismatch between my body and my brain. It wasn't suppressed in my subconscious anymore. It was screaming at me all the time. I couldn't do simple things like read because I'd look down and see breasts that my brain didn't expect to be there. I was miserable. Dysphoria isn't just disorienting, it's completely consuming. So on this National Coming Out Day, I don't want any trans person to feel that they have to live as someone who they're not. But if a trans person comes out but then doesn't have the ability to get health care, it's a recipe for disaster. You may know the statistics about depression and suicide and poverty among trans people. Well, a lot of that could be remedied by healthcare. I was unemployed for a year. I had enough privilege that I didn't end up homeless or worse, but not everyone is that lucky. Trans women who are visibly transgender and can't get facial surgery experience rampant employment discrimination and street harassment on top of the dysphoria they experience from not recognizing themselves in the mirror. And trans men who come out and start testosterone but can't get top surgery can have terrible dysphoria and face safety issues. Having facial hair and a deep voice but still having breasts can set a person up for verbal or physical harassment. So if you want to support trans people on National Coming Out Day, using the right name and pronoun is a great start. We also need to knock down all the barriers that trans people face trying to get healthcare. The difference between getting trans healthcare and not getting it is the difference between living happily and living in real pain, and sometimes the difference between life and death. There are people struggling with debilitating dysphoria every single day, just like I was before I got healthcare. Transcend Legal is a small startup organization operating on a shoestring budget, but we're having great success helping trans people get healthcare that they couldn't get on their own. We're providing lots of free and low-cost services and advocacy. We're doing a lot with a little, but there's much more we're capable of. Our aim now is to hire a few more attorneys. There's no shortage of attorneys, trans or not, who want to do this work. They send me unsolicited resumes, but I can't afford to hire them. My staff and I are trained in the law, not fundraising. So please help in any way you can. Share this video with your friends. Sign up for our email list to stay up to date with what we're doing. Check out our video series on how to get trans care covered under insurance. If you want to volunteer, we may have a need for you. And finally, please donate if you can, whether it's one time or every month. Together, we can ensure that next year on National Coming Out Day, more trans people will be able to come out with the knowledge that they can get the healthcare that they need to be who they are.